doctors, also as a dentist, and during the checkup of the children in Armavir Maldives, I understand that they are really in the worst conditions. So they don't end these programs. That's why I can't use the numbers in my paper and in my presentation. That is the main idea that I chose it.
Have you identified potential donors to apply with your proposal?
Not yet.
Can't you try co-op?
I think yes. Thank you for the suggestion.
Could you clarify for the audience about your intervention? In Armavir, will you have a sample, or how will you do your intervention?
For the Armavir, we will do intervention for the all kindergartens in Armavir Maldives, but for the evaluation, we will select 29 participants only for the evaluation.
Questions or comments?
Do you have some curricula already for trainings, something that is prepared?
I prepared some. The main idea it is that first you have some points for trainings. The special, for us it is very important training with the children, because as you know, training with the parents and nanny, in my opinion, it will be a little bit easier. But trainings, the materials we are prepared. I think that we will prepare with some specialists, psychologists, to do that information more easier to understand the children and to fix their minds. And the main idea of this paper that the children started with this age will continue to understand the importance of their oral hygiene and will keep their teeth, brush the teeth, and keep the right nutrition during the whole life. And also maybe they can suggest also their friends, why not?
Thank you.
Okay, if no more comments, questions, thank you, Artem. So our next speaker is Karin Karvoyan.
Good afternoon, everyone. So I'll present you my thesis project, which is about oral hygiene of children under 2 years of age. It's a qualitative exploration of maternal knowledge, attitude, and beliefs and experience. So first, I'll provide you a background. Then I'll talk about the situation in Armenia. Later, I'll talk about the methods of the study, then the results, and finally about the discussion. So what is dental caries? It's a localized chemical dissolution of the tooth surface caused by metabolic events taking place in the biofilm that cover the affected area. And early childhood caries causes infants and preschool children. ECC develops because of regular consumption of food containing high sugar and the presence of Streptococcus mutans bacteria. As a consequence, ECC causes increase in the risk of caries development in permanent dentition, reduces the overall growth of the child, and later it might interfere with the child's school participation and learning, and eventually it affects the child's quality of life. American Academy of Pediatric Dentistry gave some guidelines to prevent ECC. These guidelines include oral health risk assessment, which should be done by 6 months of age, establishment of dental home, which is the ongoing relationship between the dentist and the patient, which should be done by 6 months of age, 12 months of age, oral hygiene, which is toothbrushing twice a day as soon as the first tooth erupts, and diet. ECC recommended low caries risk diet and prevention of bottle feeding with juice at night. And American Academy of Pediatric Dentistry confirmed the effectiveness of fluoride and its safetiness. So the children, depending on their age, should use fluoridated toothpaste, and topical fluoridation should be applied for those children who are at high risk of dental caries. Children under 3 years of age are dependent on their parents. That's why they are in unique oral health challenge. So the parents are responsible for establishing oral health related behaviors by teaching their children and supervising toothbrushing, making the right dietary choices, and forming a positive connection with a dental professional. And inadequate parental knowledge, attitude, and beliefs would cause poor oral hygiene, and it might also cause dental caries eventually. Now, recently in Armenia, there is no implementation of fluoridation or other nationwide dental caries preventive programs. There is also no nationwide estimates for ECC prevalence in Armenia. A study done in Yerevan in 2005 showed that 84% of children between 5 and 7 years old needed dental treatment. Another study in Sisian, also in 2005, showed that 86% of children of 12 years old have prevalence of dental caries. A study done in 2012 in Tavush showed that the decade missed and filled teeth indices are around 97% among 6 years old children, 96% among 12 years old children, and around 91% among 15 years old children. And the study done in 2005 in Yerevan showed that 61% of the participants' mothers had either no or poor oral hygiene knowledge. And the limitations of this study was that it was a quantitative pilot study and it included 62 participants. So accordingly to date, no studies have examined how Armenian parents care for their children's oral health and whether they are aware of recommended oral health habits and regular dental visits. So the objectives of our study was to explore the oral hygiene knowledge, attitude, and beliefs of mothers in children under 3 years of age, and to describe mothers' experience of oral hygiene and dental care for themselves and their children of under 3 years of age. So for our study, we used the Proceed model, which helped us to guide. It is a model that helps explain health-related behaviors and environments, and consequently it designs and evaluates health promotion planning. So we used the phase 4 of this framework, which is the educational and organizational diagnosis. It includes 3 factors. The predisposing factor includes the knowledge, attitude, and beliefs, which motivates the behavior. The reinforcing factor, it includes the support of the surroundings, the feedback of the surroundings, which may encourage or discourage the behavior. And the enabling factor include the environmental factors, which include the availability, accessibility, and affordability. So for the study, we used qualitative cross-sectional design. We recruited by purposive and snowball convenience sampling. Data collection took place between February and April 2016. We had 6 focus group discussions with mothers of under 3 years of age, and 4 in-depth interviews with pediatric dentists, and public health specialists working in the field of oral health in Armenia. We used the semi-structured guides for both the in-depth interviews and the focus group discussions. Some of the questions of the guide were taken from another guide of a similar study. We grouped them into domains predisposing, enabling, and reinforcing factors, and then we revised them and edited the questions according to to ensure the compatibility and with the Armenian context. The study was approved by the Institutional Review Board of the American University of Armenia. Data analysis was done after transcribing the audio records and translating them to English. Deductive concurrent content analysis was used, coding of words and meaningful phrases was done, and we achieved saturation. So the mean duration of the focus group discussions was 67 minutes and 23 minutes for the in-depth interviews. We had 33 participants. The mean age of the mothers were 32 years old, and for the in-depth interview participants was 33 years. So as a result, the mothers said that they brush their teeth only once a day, and they also brush their child's teeth. The ones who brush their child's teeth only also once a day. And those mothers who brush their child teeth either didn't use toothpaste or they used fluoride-free toothpaste. And the mother said that they only visited the dentist themselves and their children when a dental problem occurred. So one of the mothers said, actually she, the child, had a problem. That's why we took her to the dentist. I mean, she said that I had pain and I took her. So almost all of the mothers knew the importance of the oral health, and most of them knew the problems of the oral cavity. They mentioned about caries, gingival problems, and also problems of mucous membrane and tonsils. But there were many mothers who thought that the reason for having repeated dental caries are genetically inheriting bad quality teeth from their parents. So one of the mothers said accordingly, my front teeth, I used to break them easily from eating anything since I was very young. Genetically, I have had very unsuccessful teeth. There were some mothers in our study, or in our participants, who didn't know the importance of the primary teeth. They said that eventually the child will lose them and they will have their permanent teeth. So one of the mothers said, I haven't seen any importance in the primary teeth. That's why I haven't done much about it. Didn't take care of her child's teeth. And the in-depth interview participants also confirmed this finding. So the public health specialist said, our experience from areas show that mothers do not give importance. Most of them do not give importance to primary teeth because they know that they're going to change it. The child will have the permanent teeth instead of the primary ones. They don't take care. They don't care about these teeth. They get rid of them easily. But also in our participant mother, there were many of them who knew the importance of the primary teeth for the health of the child. They said that it's important for the, appropriate eating, so that the child will eat appropriately and would pronounce letters appropriately during speech. And also they thought that they said that it is important for the permanent teeth of the child. Now the mothers knew that toothbrushing should be done twice a day, but they didn't know the right techniques of toothbrushing. So we'll say they didn't know, most of them didn't know the right motion.